the cloud. Okay, so we're now recording. And I think others will be joining us, including, I think Councilmember Rosenthal is going to be joining us, and also maybe Councilmember Koslowitz and others. We have a good attendance in the in terms of attendees. So let's get started. So happy Denim Day. We're nearing the end of Sexual Assault Awareness Month, Sexual Violence Awareness Month. I know we use those terms interchangeably. My name is Jimmy Marr. My pronouns are he, him, his. I'm policy director for Safe Horizon, which is the nation's largest victim services nonprofit, serving the 5 boroughs here in New York City, helping over 250,000 New Yorkers each year who experience violence and abuse. And I'm also secretary of Denim Day NYC, which is a humbling experience. It's always wonderful to be in community with so many wonderful advocates and survivors. And this year's theme is Beyond the Jeans. So for folks who don't know, I think everybody does, but Denim Day started in response to a court case in Italy in the 1990s when a Supreme Court in Italy overturned a rape conviction because their reasoning was that because the survivor had been wearing tight jeans, that she must have assisted in removing them, thereby implying consent, which is absurd. And the women in the Italian parliament responded by wearing jeans to stand in solidarity with the survivor, and also to just shine a light on all of the myths and misconceptions about rape, sexual violence throughout the world. The Denim Day campaign started in the United States in Los Angeles by our community partner Peace Over Violence. And soon after, the campaign came to New York City, and Denim Day NYC has really been coordinating those campaign efforts each year since then. We are a community of advocates, survivors, government officials, many different people across New York City who are really just trying to shine a light on all of those myths and misconceptions about sexual violence. This year's theme is Beyond the Jeans. So we recognize that Denim Day started in response to the courts, so understanding that the court systems often fail survivors and don't really do very much to end sexual violence. This year, we were expanding the campaign just to shine a light on all of the different ways that many of our systems, all of our interconnected systems, often fail survivors and often do very little to end or prevent sexual violence. So as part of our Beyond the Jeans campaign, we're also just asking folks to help us to reimagine what safety looks like, reimagine what healing looks like, reimagine what justice looks like, because it really takes all of us. It takes an entire community to really end sexual violence once and for all. We also recognize that many of our partner agencies and organizations approach this work in different ways. Some of us are more focused on prevention. Some of us are focused on youth development, on community development, on healing work, on justice work, and it really requires all of those approaches together collectively to really to end and prevent sexual violence. So thank you so much to our partners in the Women's Caucus of the New York City Council, who have been steadfast partners in this work for forever. And for helping me to coordinate this event. We have an excellent, strong panel of advocates here to share their expertise. But to kick things off, before I introduce our panelists, I also just wanted to offer an opportunity to our partners in the City Council to offer some remarks. Just today is Denim Day and April is Sexual Violence Awareness Month. So I don't know who would like to kick us off. We have 3 wonderful council members here. How about, we'll start with Councilmember Vanessa Gibson, since this is a Women's Caucus event, and she's the co-chair of the Women's Caucus. So Councilmember Gibson.
Thank you so much, Jimmy, and good morning, everyone. It's a great honor to have all of you here for this very important Denim Day 2021. I am Councilmember Vanessa L. Gibson of District 16 in the Bronx. My pronouns are she, her, hers. I welcome each and every one of you to this very important event. Thank you, Jimmy. Thank you, Safe Horizon, my co-chair, Farah Lewis, Councilmember Dharma Diaz, Councilmember Helen Rosenthal, Councilmember Karen Koslowitz, all of the wonderful women of the New York City Council Women's Caucus, Girls for Gender Equity, the New York City Alliance Against Sexual Assault, RISE, Pride Center of Staten Island, Steps to End Family Violence, and VIP. Thank you all for being a part of today's very important event, Denim Day 2021, Beyond the Jeans. As co-chair of the Women's Caucus, I am proud to stand with all of you here virtually today in solidarity with my colleagues, with so many of our amazing and strong survivors, our relentless advocates who do this work every single day, community organizations, and so many of our partners on Denim Day as we reimagine how we can continue to push and advocate for a violence-free world. It was only a year ago that our city was the epicenter for a global public health crisis known as COVID-19 that completely altered our way of life. Our businesses were forced to close. Many employees were laid off from their jobs. So much food insecurity across our communities. And New Yorkers, many of our neighbors and constituents, were forced into isolation as a precaution to reduce the rate of COVID-19 infections. What a year this has been for all of us. Despite the challenges that the pandemic has posed, our providers have been on the front lines, working remotely, doing home visits, talking to clients, and really adjusting to this new reality. And we're providing the services to our survivors and other vulnerable New Yorkers. I want to recognize and highlight these heroes and sheroes, many of whom are with us today, for your work in providing vital, critical services to all New Yorkers during a very difficult time in our city. Even now, as we slowly begin to reopen a year later, we know that there are still challenges for many of our survivors. April is Sexual Violence Awareness Month, but we all know and understand we do this work every single day. In 2018, the City Council passed historic and comprehensive legislation known as Stop Sexual Harassment in the Workplace. And this package of legislation strengthened our anti-sexual harassment policies for all of our employees to have a safe outlet and an environment to report harassment in their place of employment. The Me Too movement also highlighted the need for many of us to take immediate action to address this crisis. However, we know that there is still much more work that needs to be done to ensure protections for all survivors in preventing sexual harassment. In June, we will be passing a city budget 2 months away, and my colleagues and I on the budget and negotiating team and the Women's Caucus, the BLAC, the Progressive Caucus, the LGBT Caucus, all of the caucuses, we will be fighting hard to ensure that we have support and resources and programs for all of our survivors and families and their support system. We want to make sure that any recovery plan around COVID must include women, gender expansive New Yorkers, our LGBTQIA+ community, TGNC community, vulnerable New Yorkers, our BIPOC New Yorkers, and all other marginalized New Yorkers that we represent every single day. Every New Yorker has a fundamental right to be safe. And if you know someone that feels unsafe, please contact us. Our non-for-profit providers, many of whom are with us today, are always available to provide resources, language access, and support for you. You do not have to endure this alone. You are not alone. We are with you, and we want to assure you that you can survive. You can be a survivor of your circumstance and not a victim of your circumstance. Each organization will share their information in the chat today, but please save this information and most importantly, share it with someone else. You never know when you might need it or when it could potentially save someone else's life. I want to once again thank our partners for joining us today. Thank you, Safe Horizon, and all of the organizations for joining us on Denim Day 2021. I also want to remind everyone who's watching that we wear denim not just to honor our survivors of sexual assault and sexual violence, but to show our ongoing commitment to advocating for equity and fairness and justice and fighting for a society that is free of sexual violence and all other forms of violence. Our work continues. It will never end until we no longer have to have Denim Day. And I look forward to that day. And I appreciate all of you, and to all of my colleagues and all of our community partners. Thank you. Also want to thank my amazing Director of Outreach, Michael Ivory, who always makes sure that we come together in these spaces and allow all of our clients and others to know that they have support. You are not alone. Welcome to Denim Day 2021. Thank you so much for joining us today.
Thank you, Council Member. I'm going to turn it over to the other co-chair of the Women's Caucus, Council Member Ruiz.
Thank you so much, and good morning, everyone. I'm Councilmember Farah Lewis, co-chair of the Women's Caucus, and I want to thank you all for joining today. And I want to recognize my co-chair and a phenomenal woman, co-chair Vanessa Gibson, and the Sheroes in our City Council, our Women's Caucus members. I see Dharma Diaz, Helen Rosenthal. I think I saw Karen Kalsowitz, and if I missed anyone else, blame my head, not my heart. And I just want to also thank our phenomenal partners today, Safe Horizon, Girls for Gender Equity, NYC Alliance Against Sexual Assault, Pride Center of Staten Island, Ruiz, I see Haley today, good morning, Steps to End Family Violence, and the Violence Intervention Program, who have been on the front lines for survivors of gender-based violence. Thank you all for your service and your support through the years. And thank you also, Jimmy, and your team for organizing this important conversation today. Every 73 seconds, an American is sexually assaulted, and every 9 minutes, the survivor of sexual violence is a child. Consent should not be inferred, but heard. No means no, regardless of gender, age, clothes, location, or time. No means no. In communities across this city and around the world, women are wearing denim and standing in solidarity with survivors of sexual assault because we know that there is strength in numbers. We believe survivors, you are not alone. Today's roundtable is a critical step in assessing where we are now and what we need to work on and what lies ahead as we go beyond the genes. Together, we can explore how we can amplify more stories of survival, support our sisters as they cope with the emotional, mental, and physical scars, and push for justice, but also champion the issues that matter most to women and girls who deserve to be respected and treated like queens. Your voices are tireless. Your voices and tireless commitment have been pivotal to the policies and historic investments that have been made and seen and changes the narratives from victim blaming and shaming to protecting and uplifting survivors. And Co-Chair Gibson spoke about that in the legislation that's being passed and pushed forward by the council. So I want to thank my colleagues and survivors and advocates and all that are here today for Denim Day and for participating and shining light on this issue that thrives in darkness. Let's continue to raise awareness, especially about rape culture, because we don't do enough of that. We need to have a conversation about rape culture. And not only in April regarding Sexual Assault Awareness Month, but 365, this conversation needs to happen. Thank you so much, Jimmy.
Thank you, Council Member. Now I'm going to turn it over to the Chair of the Committee on Women and Gender Equity, Council Member Dharma Diaz, one of the newer council members in the City Council.
Well, I just want to say good morning. My two colleagues that spoke, amazing presentations. I look forward to hearing what former Chair Rosenthal will have to say. I'm sure she has a lot of energy and conversation to have toward the issue. Again, I'm Dharma Diaz, one of the newest members, and I'll take it on to just share a personal story of my little younger years when I was first getting involved into the political arena. I didn't know I was being sexually harassed in the workplace. You know, I remember having a conversation with saying, I want to learn, teach me. And then, you know, as the Me Too movement became bigger, it was more of a conversation, it allowed me to reflect. And I thought back to the moment where I did feel uncomfortable and I did have a conversation with my superior and it was disregarded. You know, and I shared it to say that unfortunately, many times we're experiencing things in the workplace, situations that are uncomfortable, and we say that the individual is ignorant or we fear lack of employment. We're not sure if we speak out, what's going to be, you know, what's going to come out of that. You know, thankfully, I moved on. I've been able to take my negatives into a positive. I see the individual every so often, he's actually become a menace for me in the political arena. So I just say, watch me fly, watch me rise, get out of my way, because you can't stop Dharma Diaz. And I also share that's definitely personal, but we're real people at the council. We're here to be your voice. When we fight on an issue or challenge an issue, just know that we're hearing you loud and clear. Even if you don't see us, we're here for you. Again, I'll return it to you and thank you for this opportunity today and what you're doing, fight to fight. There's so many that they don't know what they're being abused of. And I identify as she and her and hers. Thank you for the opportunity again.
Thank you, council member. And then last but not least, and a council member who doesn't really need very much of an introduction, another one of our champions in the city council, former chair of the Committee on Women and Gender Equity, and somebody who actually emceed one of our past Denim Day rallies when we were able to do these things in person, council member Helen Rosenthal.
It's an honor to be here, especially today. It's Denim Day, and it's the day to remember that we believe women. I think it's important that as women come forward, the first thing we do is believe them. So Denim Day is a wonderful opportunity to remember that, reinforce that. So I'm here as an ally. I'm here as an assist now to Councilmember Diaz, Councilmembers Farah Lewis and Gibson, who are extraordinary leaders. And I'm looking forward to the discussion. Thank you.
Thank you all so much. So now I mentioned at the top that we have an amazing panel that we've assembled today to share their expertise, their insight, their passion, their activism. So I'm going to introduce each person one by one and just ask everybody to answer a question. I'm just going to pop it into the chat. So I'm going to first have our friends from the New York City Alliance, Monica and Michelle. The question is, how does your so first introduce yourselves. Introduce your organization, and tell us, how does your organization currently define and respond to violence to protect and support survivors, and what resources are available to survivors who might be listening? So Monica and Michelle.
Hi, thank you. Thank you so much, Jimmy and council members. That was an amazing introduction. My name's Monica Castro. I use she, her pronouns. I'm from the New York City Alliance Against Sexual Assault. And specifically at the Alliance, I manage our Sexual Assault Forensic Examiner Training Institute program, otherwise known as SAFETY. And we provide 40-hour sexual assault forensic examiner trainings to hospitals all across the city. We work with Department of Health to get these medical professionals trained and trained in a way that they can respond in a trauma-informed way to survivors that might present to local hospitals, local clinics, looking for medical care, forensic care. And I'll go into a little bit what the Alliance is outside of the SAFETY Institute. We have a lot of different facets in our organization. We do prevention work, which Michelle from the Alliance is also here. She's going to speak on some of our awesome prevention work. And we do youth groups. We have an amazing legal services program. We have counseling services, advocacy. All these services are free. And we have a lot of folks behind the scenes doing amazing policy work as well. And so our organization, how we define violence, since we specialize in sexual violence, we define it as any sexual act perpetrated against someone's will that breaks a person's trust, violates their safety, impedes upon their sexual autonomy. Sexual violence is also an umbrella term that encompasses, rape, sexual harassment, revenge porn, stalking, catcalling, and so much more. And sexual violence it's a traumatic event. It can be a medical crisis, a medical issue. It can feel like a threat to survival. It can be a threat to societal health. And it's also an injustice too. And so I'll go into a little bit on how we respond. Like I said, we have confidential counseling. We have confidential helpline. We have a chat function too that survivors and youth can engage with if they don't want to call our helpline or see anyone over now Zoom face to face. They can engage with our chat, which we've seen has been really impactful. And we do advocacy, criminal justice advocacy, and all of that in a trauma-informed approach and survivor-focused healing. We work with survivors so that they know their options with law enforcement and with our safety program. And with our safety program in particular, we're just looking to increase access to health and wellness through our safety program and work with hospitals to improve their healthcare services for survivors who might present in the ED or in a local clinic, looking to, maybe get a forensic exam or a rape kit is what it's referred to as. And we provide this specialized training for these medical professionals that come from all different hospitals across the city. And we work with them to ensure that they're getting this specialized training. They're learning not just about like how to perform a forensic exam, but how to approach patients in a patient-centered way and just work with the person and not kind of pathologizing them and taking always that very like medical approach, which can often feel very dehumanizing, dismissive. And so we work with these medical professionals and these healthcare systems to just improve their services and be more patient-centered and learn how to work with survivors of different identities that might be presenting for care. And then after we train their medical professionals, we continue to provide support to these hospitals and rape crisis programs that are working with survivors on the ground every day to improve their policies, their protocols that they have in their hospitals or their programs. We help to train advocates across the city, advocate programs that respond to the hospitals and are like very critical in the work with survivors. Advocates are amazing. And they are just an emotional support and provide amazing options for the survivor and are just there to help them be support and guide them through a process that can be really hard and confusing and scary. And we collaborate with other systems such as child advocacy centers across the city, DA's offices. We provide training to NYPD, all of these organizations just to help improve their knowledge around survivors and increase and better their practices in working with survivors as well. So that's a little bit about what our response is, and I'll give it to Michelle to talk about a lot of our amazing prevention work that we're doing as well.
Hi everyone, my name is Michelle Hankhouse. Thank you, Monica. And thank you, council members, for your introductions. I'm just going to talk briefly about the prevention work that we do here at the New York City Alliance as well. I think when we're talking about resources and support for survivors, prevention is hugely important to integrate as well. At the Alliance, we are a part of the Rape Prevention and Education Program through the New York State Department of Health, which is a statewide initiative to help prevent sexual violence. So we're one of 6 regional centers that is working on this statewide initiative. And we have prevention programs focused on youth populations in neighborhoods and in nightlife settings as well. And so some of the prevention programs that we implement are around education and training for those populations. So among youth and also, nightlife professionals, people who work in bars and the various roles in nightlife settings. So education and training is one thing, but a huge component that we should focus on is community level prevention. So it's also thinking about policies that we can change within organizations, within communities, within nightlife establishments to help prevent sexual violence. Looking at policies as well as our environments, what at the environmental level can we change to create, a greater effect on prevention, and that's really going to be like a systems-wide change when we work towards these community level prevention strategies.
Oh, Michelle, I think you're breaking up. Oh,
Sorry,
Thank
did
you.
you hear me?
Not the final sentence.
Okay, well, we'll talk more. That was just a brief introduction to our prevention work at the Alliance.
Thank you both so much. And now I'm introducing Michelle Greer from GGE, Girls for Gender Equity. Same question.
Okay, thank you, Jimmy. Really appreciate the space that you have cultivated today along with the Women's Caucus. Thank you, City Council members as well. I am Michelle Greer. I go by she, her, representing Girls for Gender Equity, and I support our programmatic work. So at Girls for Gender Equity, we center the experiences of cis and trans Black girls and gender expansive youth. When we say gender expansive youth, we mean non-binary young people and gender non-conforming young people of color through local, state, and national intergenerational policy, advocacy, and direct service and culture shift work. And so we think of ourselves as like a three-legged stool that we have to engage all of these things in order to address the violence that we know our young people are experiencing when it comes to gender and racial justice. And we do that through a Black feminist lens. So for us, violence is a all-encompassing term for the different ways in which our young people are experiencing and going about their lives when they experience racialized trauma or gender-based trauma. At GGE, we work alongside young people. A lot of our young people have had the opportunity to meet their city council people, to meet their local organizers, meet other folks who are on this team, to be able to name their experiences and amplify their stories. We see this as a huge part of working alongside young people to address their survivorship, to let them know that they're not alone and that there are resources and that there are ways to prevent this for the next generation. Actually, Jimmy, in preparing for speeches for tonight, was talking with a young person today just about their experience of having sleepovers and talking with another friend and being like, oh, that happened to you, that happened to me, and how pervasive that is, but no one's talking about it in the spaces that they come to for support. And so we think of ourselves as being able to provide that preventative education alongside comrades. So we do work with STEPS and Day One who have their RAP coordination in schools. And then we amplify that message to say, you know what, we need to make sure that this is more prevalent in all of our schools. So not just some young people are experiencing this, but a whole crew of young people are experiencing this. And then we'll go over to Rise and be with Haley on the streets in terms of addressing the intersection of street violence and also what we're saying, domestic violence and interpersonal violence, and naming the ways in which that shows up. So we know that there's multiple intersections and ways in which we need to be having this conversation that are both at the preventative level with our young people, and then that come along when we think about policy, when we think about campaigns. And so directly what we do with our young people is we hold cohort model. So they come into our programs usually around the fall, and then they get to be with us for 10 months, growing in relationship with one another, sharing in their stories, sharing in their healing, and then creating and cultivating campaigns and spaces which they can then bring back to their communities and to various forms of leadership, including other youth leaders, right? So we know that there's a lot of youth movements right now. How do you have these conversations within those spaces? I think something that's critical at this time is that we do see a lot of young people who are naming that they're having more experiences since being quarantined at home, or the shifts in lack of access to being out in spaces that they are able to go to. And so just being able to name that and really be clear that we need these spaces, be clear that we need these spaces and that they need to be funded and that we need to have enough information. I was a school social worker for many years, and I can honestly say I know that there's a lifting up of needing this in schools. Also, the social workers and the supports in schools need to be trained on best practices, right? And so that's at the heart of what we do at Girls for Gender Equity. And I will be quiet now so we can pass the mic and have this conversation.
Thank you so much, Michelle. And now I'm going to turn it over to Zach from the Pride Center of Staten Island.
Hi, everyone. Thank you so much for having me. Thank you, council members. Thank you, Jimmy, for all your hard work into putting this together. I am Zach Faber. My pronouns are he, him, his. I am the Youth Service Coordinator at the Pride Center of Staten Island. We work with everyone ages 13 to 24 on the LGBTQ spectrum and open to anybody. Our organization sort of defines any sort of sexual assault, sexual violence as anything without consent, anything without permission, anything that is physically, emotionally, verbally traumatizing to anybody within the LGBTQ community. And what a lot of folks don't, also the demographic, when you break down and look at the numbers between sexual assault, domestic violence, we sort of forget that the LGBTQ community, they play a major role in some of the numbers and demographics, especially the trans community. Almost 50% of the trans community experience sexual violence, domestic abuse, or sexual assault in some form or case throughout their lives. And as you look at the different numbers, BIPOC communities, Middle Eastern, multiracial, they also experience somewhere between 55 to 60% of abuse, domestic violence, sexual assault, when you look at the numbers from there. So we here at the Pride Center really want to make sure that we're reaching out to our LGBTQ survivors and victims of sexual assault, domestic abuse, and providing them the resources and saying, we see you, we hear you, and we want to be here for you. You are not alone. So we, part of my job as a youth service coordinator is providing them with counseling. We have free one-on-one counseling here at the Pride Center, where a counselor will meet with them and sort of talk with them about their experiences, what are some of the resources that we can give you, who we can refer you to. We work with another, lots of local Staten Island organizations, such as Community Health Action of Staten Island. We work with Hollaback Girl in training our youth, because education is extremely important, especially at such a young age. So I would go out and speak to GSAs, I would speak to classes and schools all across Staten Island about the importance of consent, about the importance of knowing boundaries, and about educating them about seeing the signs of domestic violence and how they can be better advocates. Because the younger generation, think about it, they are the next generation. So the more we can do now today with the position that we are in, the better we are preparing the next generation to be allies and to support women and to support the LGBTQ community should a situation like this ever arise in their lifetime. So that education is a very big aspect of what we do here at the Pride Center of Staten Island. We also do education and outreach, where we go out to schools and businesses and local organizations and teaching them about the importance of consent and being allies and speaking up for victims of domestic abuse and sexual assault within their own community. So that's sort of a little bit of what the various things we do here at the Pride Center of Staten Island. I can go into, probably spend hours about all the amazing things we do here at the Pride Center, but with the limited amount of time I have, I don't want to sit here and talk, but trust me, to all the victims and survivors out here, we see you, we hear you, and we want to be here for you, especially if you're a part of the LGBTQ community and you feel like you have nowhere else to turn to. Please know the Pride Center of Staten Island is here for you. Reach out to me and we are going to help you provide with all the resources that you will need. Thank you.
Thank you, Zach. And Denim Day NYC is so excited. We always have a very strong Staten Island presence in our Denim Day NYC work. We're so happy to have the Pride Center, Chauncey, Safe Horizons Staten Island programs, and so many others that are doing this work each year that like Staten Island just like overtakes all of us when it comes to doing this work around Denim Day. And now I'm going to introduce Haley from Ruiz.
Hi, everyone. Good afternoon. Thank you to each of the council members for taking the time to have this very important conversation with us on Denim Day. We appreciate all of your efforts in increasing awareness and resources to combat sexual violence. And also thank you to all of my colleagues in the work that are on this panel, together today, just everyone that coordinated it and just everyone on the panel that's here sharing their expertise and also lifting up all the survivors today. My name is Haley Nolasco. My pronouns are she, her, hers, and I'm the director of the RISE project at the Center for Court Innovation. And RISE is an extension of the New York City Crisis Management System with the goal of transforming responses to intimate partner violence across New York City. And we do this in a host of ways. And the main ways, the crux of it all, is really addressing this intersection with gun violence, engaging community to develop new strategies, supporting healthy relationship norms, and also engaging people who cause harm to actually take accountability and also begin to change their behaviors. And when we think about violence and looking at the question, we understand that violence is harm that's caused. It doesn't happen in a vacuum. It's a symptom of oppression and harm caused by systems. And that really grounds the work that we do at RISE. And then when we're addressing violence, we address incidents of violence, yes, so crisis response on an individual level, but also on a community level. But we also really work to address the underlying conditions that really allow violence to really occur and also to be tolerated over and over again. And the resources that we have available for survivors is really listening. So listening to folks. And I think that's something that at times gets lost in the traditional systems and the way it currently exists. Like really sitting down with them and asking them, like, what do you really need right now? Like what does support really look like to you? First and foremost, right? Advocacy. And I second all of my colleagues and what everyone has said. The system's really hard to navigate. So we really work to support to navigate those systems and try to facilitate it the best way possible. Unfortunately, in the work that we do, we notice that sometimes these systems do not always take a human-centered approach. So we want to bring that human aspect and compassion and love into the work that we're doing with them. So in addition to the advocacy, also safety planning. So working with survivors to develop creative plans to address safety and using community networks, because that's super important. Like what do these community, like what do these safety nets really look like in community, right? And building that, asking them, what does that look like for you? And let's help, bridge that together. And then, just putting together any other resources that make sense to them and what they're saying that they really need. Connecting them in community, shifting community responses and the tolerance to intimate partner violence. So that's also walking around with community-based organizations that we work with, just like GGE, also our crisis management system partners as well, going out to community, disrupting these norms that allow for violence to happen in relationships, right? And then we also we offer service referrals as well. So understanding that many survivors we work with do not always have their needs met by traditional work, like we mentioned before, although very well intentioned, but sometimes everyone's needs are very different. So understanding what that is and really working with them to approach that, and just continuing to engage and advocate and support them through the process. So I know it's a little brief, but that's really what we all do in a nutshell, and we do it with a lot of love and really looking at the root causes of violence and working to dismantle that. Thank you.
Thank you so much, Haley. And yeah, I mean, I'm very happy that our community of anti-violence advocates have really intentionally tried to de-silo all of these different forms of violence, that we can't be talking about sexual violence without talking about intimate partner violence, without talking about gun violence, without talking about hate violence. So it's just, I'm so happy and grateful to have RISE and everybody involved in this work. And now I'm going to turn it over to Julia from Steps to End Family Violence.
Thanks, Jimmy. Hi, everybody. Thank you to the Women's Caucus and to all the council members and to our colleagues here. I'm really happy to be able to be here. I'm Julia Shaw. I'm a co-director of the Criminalized Survivors Program at Steps to End Family Violence. And STEPS is a program of Rising Ground. For folks who may not be familiar with STEPS, we're a mainstream anti-intimate partner violence, anti-gender-based violence program. And we have a range of really dynamic and robust programming. We have community-based programming that includes services for children as young as infants who may be impacted by abusive partner behavior. We have relationship abuse prevention services for young people in middle schools and high schools. Michelle mentioned we have a collaboration with GGE related to involvement of young people or young people who are at risk of involvement in the youth justice system, with a particular emphasis on queer, trans, gender non-binary youth of color. And so we have a real focus on prevention and healing of gender-based violence. We do a lot of advocacy and we engage in activist efforts to really challenge institutions that reproduce violence and that use violent rhetoric. And we offer a lot of training to try to educate the public, educate providers around ways of reducing violence, around ways of disrupting the continuation of gender-based violence. I want to mention just a little bit, and this gets to Jimmy's point and other folks' point about relationships among different kinds of violence, but I want to mention just a little bit about the founding of STEPS. And as many of you may know, STEPS was founded by Sister Mary Nerney. And it was founded as a two-person court advocacy project supporting survivors of gender-based violence who themselves were labeled as defendants in cases, so facing felony or misdemeanor charges, really for protecting themselves, protecting their children against abusive partner behavior, charged for being coerced into allegedly participating in activity labeled as illegal. And I want to mention this because it's important that the starting point for STEPS is really grounded in challenging binaries of all kinds. We challenge binaries with respect to people and systems that cause harm, and people who experience harm on an individual level, people who experience harm from systems. We disrupt binaries related to distinctions between survivors who are deserving and survivors who are seen, labeled as not deserving of authentic care and support, disrupting binaries between people labeled as defendants versus people who are complaining witnesses, distinctions between who's in jails, prisons, detention centers, and people who are not, and disrupting binaries about the whole notion of safety. Safety as defined by law and order rhetoric and policy, and safety that's defined by communities. We also really, I think, work to disrupt the very common sort of divisions between survivor-focused practice and efforts like abolitionist practices that are really meant to challenge the oppressive systems that reproduce all forms of violence. So we really want to ground all of our work in that, but also recognizing that survivors are not a monolithic group, that survivors want all kinds of things and should have access to a range of different responses to violence. So I'll just very briefly and sort of touching on what Haley mentioned is that how we define violence is really from listening to what survivors tell us about what violence is. And I think that's actually a tall order. It sounds lofty and like, oh, of course we all do this, but I also think there's a lot of pressure to locate oneself as the person in the position of knowing. And I think we have to, as advocates, really push against that and listen and to resist substitution of our judgment for the judgment of survivors. And when we do that, what we hear is that violence for survivors often has to do with the kinds of systemic oppression that they experience that compounds their experiences of gender-based violence. So when we listen to what violence is, that might mean I'm experiencing violence from child welfare systems that are making it harder for me to keep myself and my children safe. I'm experiencing, fear about calling the police because police are responsible for so much violence in the world. We listen to young people who tell us that they really want to find another way to be in relationship with one another, that they want their relationships to be defined by mutual respect and understanding and love, and wanting to heal for themselves and wanting to help, be part of the healing in their families. And so from that, we know then how to respond and try to meet the need. And typically it's, I want a person to listen to me, who will be my champion, who will walk with me through this. And I want to be in community with other people who are going through something similar. So that's how we define violence and how we respond to it. I will stop there. Thank you, Jimmy.
Thank you so much, Julia. And then last but not least, Jennifer from VIP. And then after this, we're going to open it up for other more panel discussions. But Jennifer.
Good Good afternoon, everyone. My name is Jennifer Ruiz Diaz. My pronouns are she, her, hers. And I am the Sexual Violence Project Manager here at BIP, which is a program at the Violence Intervention Program. BIP as a whole has been founded here since 1984. It's a Latinx-led organization that provides healing, housing, economic justice to thousands of survivors of intimate partner violence and sexual violence in New York City each year. We have community programs, we have transitional housing, we have a traditional shelter system, and we have an economic justice program, and we have our new program with the Sexual Violence Project. Our survivors are largely from low income immigrant mothers. VIP is deeply rooted within culture-specific services of Latinx survivors and immigrant women. And just because we're mostly focused on Latinx community or women, it doesn't mean that any other person who identifies differently can receive services. We're open to everyone to receive services. And what does violence look like to us? And I think it echoes to a lot what my other panelists have been saying, which is unconsensual sexual violence, whether that be physical, whether that be emotional, etc. And we provide services to the Sexual Violence Project, provides services to sexual assault survivors, childhood sexual assault, and other sexual violence incidents that coming through the hotline or through internal referrals from other programs at VIP. We provide a group approach and individual counseling. We connect clients, as many of my colleagues have said, there is a disparity between connecting services, how difficult it is to navigate those systems. And we provide advocacy, we provide legal referrals if that's something they need. We also provide resources such as food assistance, advocacy to criminal justice systems, maybe referrals or connection to medical resources, and individual counseling, which really talks about understanding trauma, understanding some of the trauma reactions that clients are coming in with. Because most of VIP's population, it's not a one incident kind of client. Most of our clients come in with a lifelong history of different types of sexual violence or other traumatic events. And coming into VIP, it may be domestic violence with a latest intimate partner, but that doesn't mean there hasn't been other incidents of sexual violence in their lifetime. And we can't, like my other colleagues have said, separate that. So in VIP's work, as we're noticing that, we are addressing that and making sure that we are providing our survivors with that kind of help. Like if they come in with intimate partner violence situation, and then may have, as they build rapport with their counselor, disclose child sexual abuse, we provide them the opportunity to work with the Sexual Violence Project if they feel comfortable, or we provide more support for the counselor advocate in order to continue that relationship with them. Because we understand that clients are not come in with a lot of things, and we need to address, food insecurity, housing insecurity, many of these other things that prevent clients from fully engaging with counseling. And the way we approach a lot of these violence towards the client is with cultural community kind of aspect, trauma informed kind of aspect, and client-centered approach to a lot of these different oppression and violence that are occurring towards the client all the time, in the past, present, and possibly the future. Hopefully not the future, honestly. But I think that's where I'm going to leave it off right now.
Thank you so much, Jennifer. I could listen to all of you talk all day. Like, this is why I invited all of you. Because I mean, I really believe that like, if we had all of the resources in the, like, if we had all the resources, all the all the power, like the anti-violence community of New York City could solve any crisis, could solve any, like, we could change the world if like, we just had all the money, like if we had money, like, and the collective will to just like listen to one another more. This group of people can solve any crisis, I'm sure. So now I'm going to open it up for just general questions for the entire panel, and not everybody has to answer. And these are questions that I sent to you all ahead of time, but I'm popping into the chat so that the attendees can also see. So this year, we're really encouraging folks to just reimagine healing, reimagine justice, reimagine like all, like anything is possible. So our definition of justice has evolved and continues to evolve. What, in your opinion, should be part of our definition of justice? And what does this alternative definition of justice do to allow more and better access to healing for survivors? So I'm going to open it up. Anybody who would like to go first? Haley.
So this question really resonated a lot with me. And I was really thinking about that, the way we've been socialized, right? And many of us have been socialized to conflate justice with punishment, and the two are not the same. They're very different. And meaning that, for example, usually when someone has caused harm to someone else, we expect a response that usually removes them from the community. So we're thinking about suspension, incarceration, cancel culture, canceling folks, etc. And that's not justice. So justice, in my opinion, is repairing the original conditions that actually allowed the harm to happen in the first place, so that it doesn't happen and it doesn't continue to repeat itself, rather, right? And then further, when we're considering survivors and healing, the person that has experienced the harm should have the say in what the response is and what it should be. What would make them feel safe, and what support healing would look like, as well as others that were impacted in the community as well. So it's not just between two people, right? It's like the community at large as well. And the current legal system doesn't really give much space for that. I know many people that I've spoken to, both in my personal life and professionally, when something like this has happened to them, they don't, from my experience, many people don't want to go through the current legal system. They don't want that person to go to jail. They want the, they want the harm to stop. They want that person to transform. Even if they don't want that person, even if they don't want to be intimately involved with someone, they just don't want to, like, I don't want to ruin their life, or I don't want to be the reason why, and there's all of these things that happen. So that's not necessarily justice, because has there been anything that has actually really been done to make that person that has experienced that harm really feel at peace with the outcome? So the current legal system, like I just mentioned, doesn't really give much space for that. And when you're thinking about crime and justice, crime is usually defined as a violation of laws and an act against the state, not so much as far as like the actual harm that's happened. So it's like crime versus harm. So that's what I think about when I think about justice. It's more so like really getting to those root issues, so that it actually doesn't happen again. And when it doesn't happen again, then we have that moment to heal and really live a more vibrant lifestyle. Thanks.
Thank you, Haley. Anybody else? Zach.
So I actually do echo what Haley had said, that we cannot move as a society forward. What exactly is justice? If we think about it, does justice mean, okay, someone goes to jail and they get 9 months and then they come out? What repercussions will come from that? Which is what Haley said. Most people don't feel like they should go through the legal system because the system is flawed and it's basically created to fail them, to fail our survivors, the people we are in the position to help and achieve and to move forward. So, what is justice? And I'm going to give my perspective on the LGBTQ community. Here in America, and especially here in New York City, it seems like there's not enough safety put aside for our LGBTQ population, particularly when it comes to our trans community. A lot of times, like I mentioned earlier, most in the LGBTQ community, it's mostly the trans community that suffers the most, which is not to diminish the voice of other LGBTQ population, but our trans brothers and sisters suffer horrific incidences of sexual abuse, domestic violence, and even murder. And when someone in the trans community does speak out and say, okay, this person has sexually assaulted me, I was abused by this person. They go to the legal system. The person gets put in jail, and the person could put out a hit on our trans brothers and sisters, and they end up being murdered, which is why there's a very high murder rate when it comes to our trans brothers and sisters in the LGBTQ community, which is why a lot of time within the trans community, nobody wants to go through that whole process of speaking with the NYPD, who sometimes will not take their version of the story and will believe the perpetrator. And this system is extremely flawed, and there's so much more work than, and I'm so happy to be speaking with everyone here. We are the organization, we are the pushers, we are the light at the end of the tunnel to continue advocating, to continue being a voice for those communities that are marginalized, to say, hey, we see you and we hear you, and we want to bring justice to you. Because the justice society and the justice system had for you is not enough. It's not sufficient enough. We need to go even further than what the system is already in place here for the LGBTQ community. Not just for the LGBTQ community, but for every woman, every man out there who has to suffer. We want to make sure that the story is heard and that justice is served. Because at the end of the day, when that sentencing comes down from a judge, justice is served, but for who? For who is this justice served? So there's so much more work we have to be able to get through, or the hurdle through the legal system, through the laws, the safety net that we have for survivors and victims. And that's where we come in, our organization, to sort of change that perspective of what is justice.
Thank you, Zach. Michelle Greer.
Thank you. Haley and Zach, what you said really resonated with me, and Julia, the last part of what you had mentioned, I think combines with this, I think very much to this current moment that we have, where we have 48 states that have legislation on the table that would take away the rights of trans people. The laws that came out currently in Florida that allow people to look at children's private parts in order to identify them, that is a state of violence, right? Like that's an act of violence that is being condoned by places and spaces that are supposed to be uplifting justice. And so when I think about this conversation, I think maybe we need a new term. I think maybe we just need a different conversation to talk about relationship and human relationship, and not address all of the other, to ignore the different intersectionalities or realities of folks and their humanity, but to say, I'm in relationship with you and you're in relationship with me. And that exists on multiple different levels, including systemically, that we need to understand then what that means for us to exist safely in this space. And as we work with our young people, most of them don't have rights or autonomy over their daily existence. And so continuing to have this conversation about power and the ways that it shows up in creating safety, cultivating spaces of freedom for folks is where I think we need to continue to have this conversation.
Thank you so much, Michelle. And yeah, when I've met with different programs across Safe Horizons. Safe Horizons is a very large organization here in the city. And when I asked programs like, what is justice? What do we mean by justice? And we get so many different answers from folks. But the themes that come up a lot are economic justice, housing justice. It's like, yeah, our clients, like they want this person to be held accountable, but also they want safe and secure housing. They don't want to be poor. They don't want to be living in poverty. And when they turn to programs and our systems and our government for help, they have to jump through hoops for very, very little. So, I mean, I want us to continue to be expansive when we're thinking about justice. I know this came up after the verdict last week about like, oh, is this justice for George Floyd? I mean, justice would mean that he was still alive. Like, so if we know that justice means that the incident never happened in the first place, then let's look forward and how do we prevent future violence? Like that for me is justice, like to make sure that we're ending violence. And I believe it's possible. Maybe I'm too optimistic, but I think it's possible. I think it's possible. Before we go to the next question, and council members, if you have any questions, please let me know, because I want to open this up to you all too. But anybody else have anything to add before we go on to the next question?
I would like to add a little bit. I think it also includes like healthcare. there's something about that not being a right anymore and being taken away, and how expensive it is or not expensive. I mean, and language access, having these services to communities who don't only speak English and don't only speak Spanish. Most of our, a lot of our clients, Spanish is not also their first language. There's also indigenous language in the Latinx communities that aren't being served immediately. And also our clients may not want to ask or advocate for that because they're already talking a little bit in Spanish, and that's enough, right? Because it's already hard enough to get Spanish speaking services. Imagine adding another indigenous language that isn't commonly known to the US. So I think I echo with a lot of that. In creating justice is about also being able to have affordable housing, have safe housing, respectable jobs that, you know, are also safe, that the clients know that the rights are and people are not violating their humanity in those and taking advantage of either the immigration status, their gender, etc., in order to perpetrate violence towards them.
Thank you. Oh, Monica.
Thank you. I would just add quickly, I echo everything that everyone said. Really just coming from like my brain works within like the healthcare medical space, because we do work so closely with hospitals, clinics, medical providers. Just really remembering that you're dealing with a human when this survivor does decide to seek care in the hospital, an ED, a clinic setting, and just remembering that, like just establishing that human connection and remembering that what this person went through was traumatic. And if they define it that way, if they don't, just remember that they're a human and that you have to always remember that they know what's best for them, and just moving away from the idea that the provider is the expert, the healthcare person in the room is the expert. No, the survivor is the expert. They know what they need in that moment. And your job is to just provide options, provide resources, provide support, whether if you're a nurse, you're an advocate from a local rape crisis program, and just moving away from the view that the provider knows what's best, and just bearing witness to that person in that moment, I think goes a long way. And just really making sure to utilize like community resources in hospitals, making referrals to community-based organizations that are in the community so that that person can get like their specific needs met if they choose to do so. So just creating those partnerships with local community providers and making sure that, just you're remembering you're providing services on a human level and not just trying to perpetuate the harm that the medical system so often perpetuates constantly, no matter if you're a survivor or not. So.
Thank you, Monica. And what would it look like for all of our programs, for our government, for all of our systems to not just be humane, which already is a stretch, but human and truly trauma informed and truly like an anti-violent and anti-racist? Like that shouldn't be a revolutionary thing to imagine. So we're going to move on to the next question. Already, we're like running out of time. Like we could be here all day, like just reimagining and thinking about all of these things. A question for the panel, and this will be my last question for the panel, unless council members have questions, because I want to save some time for council member questions. But what does caring for the most harmed and most marginalized survivors look like? How is your organization centering those survivors who are most impacted?
I'll jump in.
Great.
I'm having internet issues a bit. So if I cut out, just let me know. So, I think we touched on this before, but caring for the most harmed and marginalized survivors, really looks like understanding intersectionality, understanding them as a human, that we must address the other issues that are impacting these communities and these survivors. So that's, integrating us addressing racism and gun violence and police violence and health inequities and all of the issues that some other panelists have touched on. What our organization does, we also think it's meeting them where they're at. So we partner with, local grassroots on the ground community-based organizations to meet survivors and other members of the community in the communities where they live, where they work, where they deal with some of the issues that lead to sexual violence in their communities. Our youth program, we have an education and training program that teaches about consent and healthy relationships, but we really focus on their particular, how they experience the world from their local, from their identities. What does sexual violence look like to a young person from the Bronx specifically? Not, prevention isn't one size fit all. And I think that sexual violence prevention and programs need to be locally focused and driven by, like we've been saying, survivor voices and community voices in general. So we develop, from our youth program, community mobilization activities that are driven by youth and what they see as the challenges, the needs in their own communities. And so locally focused programs, I think, are most important. And then sharing those survivor voices, the voices of young people, the voices of the communities we're trying to reach on our platform, and uplifting the solutions and the work we do with them collaboratively. We collaborate with our young people on social marketing campaigns because they know best what the issues are, what resonates with others like them, what resonates with others in their community. And so collaborating with them to find solutions and then uplifting those locally driven solutions, I think, is most important.
Thank you, Michelle. Julia.
Thanks, Jimmy. Yeah, I like this question a lot and have been thinking about it. And I think it's particularly resonant for this topic and thinking about, I think all the time about ways that efforts around gender-based violence and survivors of gender-based violence get pitted against survivors of other forms of violence. And we see this in efforts to, make changes in the criminal legal system where you can bet on the fact that survivors of gender-based violence will be invoked to oppose that change. And that's not to say that there's no validity to that. We recognize that there are a range of survivor perspectives and that some would be opposed. But I think it can be really helpful and is important in our work at STEPS to really look at what are the connections among different kinds of violence and what are the differences and what are the contexts of those violence, those forms of violence, so that, for example, if we're thinking about, really responding to sexual violence, trying to end sexual violence, if your response to that violence rests solely in criminalization and a punishment paradigm, and you ignore the ways that criminalization and punishment logics reproduce sexual violence in our communities and in jails and prisons and detention centers, then that's a problem. And if we're doing that, then we've failed to look at the ways that, as everyone has mentioned, the ways that different forms of violence intersect. And we've failed to listen then to the lessons of survivors who are marginalized in multiple ways.
Thank you, Julia. Haley, I saw you had raised your hand.
Yeah, Julia actually touched on a lot of what I was going to say, so it'll be brief, but thank you, Julia. I second a lot of what you said, especially since Ruiz, where we work, all of our target areas are areas that have the highest levels of rates of gun violence, but also domestic violence, gender-based violence as well, not surprisingly. And then our goal is to really reach those survivors who have been most marginalized and impacted at all levels when it comes to violence. And in working in these communities, we also see really high levels of criminalization, which what Julia was mentioning. And a lot of these individuals that we're working with, a lot of these people that we're working with, feel like they don't have access to systems for safety at all, because it's like, all right, well, if I tell them what's going to happen to me, then, and now will I now be criminalized? Like, there's a lot. It's very nuanced in what happens. That so similar to what I said before, really caring for those. The way we go about caring for those most harmed is again centering their needs and building a tailored plan for support, because everyone has a different story. Everybody has a different truth, right, that they're living. Every person has experienced different levels of systemic oppression at different and intersecting levels. So really taking that into our approach is what really helps us really support survivors the best way that we can. And also people that are surviving violence themselves, because a lot of the folks that we are working with are people that are causing harm as well, and they have also survived violence at some point, which is why they are now perpetuating that behavior, right? So for us, it's very important to also work with them, because they've also experienced that as well, to see what are those services that you need, again, to get to those root issues that we mentioned earlier, so that we don't continue to repeat that behavior over and over.
Thank you, Haley. So I know I'm just looking at the clock, and I know that we could fill up these last like 15, 16 minutes with so much more wisdom. And that's why I just want to kind of move to this last question that I have. But of course, if Councilmember Diaz or Councilmember Rosenthal, you have any other questions, but just to move the conversation forward, this is, oh, go ahead, Councilmember Diaz.
Yeah, I honestly, I don't have a question. Just know that I'm a sponge. I'm definitely walking up this conversation a lot more knowledgeable, and feel free to reach out to me for more intimate conversations. If there's policy you want to see different, if there's laws, if there's another activity where you'd like to see me take part in, feel free. I work for fun 7 days a week. You know, if we decide that a 3 a.m. conversation over social media needs to happen, and there's a target group or audience that you want to reach at a particular time, just know I may come in with a hat, but definitely my bottom line is I'm here to stand with you and service you. So feel free to reach out to me. I got to jump off, but again, thank you for the conversation. I look forward to deeper conversations. Thank you very much, guys.
Thank you, Councilmember. And yeah, I've been in meetings with Councilmember Diaz, and she's there with her notebook, diligently writing and taking down everything that everybody is saying. So thank you so much. Everybody take her up on that offer. My question for the panel is, what are some lessons learned or some words of advice that you'd like us all to take away from this conversation? And this isn't to pressure everybody, but like I would love for everybody to add kind of like as like a final thought that you want us all to take away from this. So whoever would like to go first?
Okay, I'll just jump in again. I can't help myself. I really like I like the summary of everything we've been talking about. If there's anything that we can leave with this conversation is really, so we have been mentioning before and talking about punishment and accountability is not the same when we're talking about sexual violence. And then rather than seeking to punish people through alienating them or isolating them, really finding ways to work together as a community to offer people a chance to respond to conflict or any wrongdoings in a way that's really meaningful and really just. And again, encouraging accountability by those who have caused the harm, and including that networks of support. And then also remembering that addressing harm isn't always between two people, again, so really bringing in the community. And lastly, to continue to challenge what we've all been taught, and just to begin to further understand the role that each of us play, whether we're working within systems or on the side of systems or to abolish systems, still understanding the role that each and every single one of us have to play while we're doing that, because the last thing we would ever want to do is to further the criminalization of people when we're trying to heal our communities. So I just wanted to leave with those little tidbits.
Thank you, Haley.
I'm gonna add on to what you were saying, Haley, because it really hit me. Especially as being a social worker and a survivor, I think oftentimes there are things that we're expected to do, there are things that we are taught to do, and finding a new approach, finding something that's creative or radical, figuring out how to do that and to navigate, you got to pay your bills and some other things can be difficult. But there's community out there. There's definitely community here in New York City. Our organizations do this work, connect with us. And also I think very much that like when folks are seeking support, sometimes that first interaction might not be the best one. And so also being willing to know that there are supports, and sometimes it's like shopping for the perfect outfit or the perfect swimsuit. Maybe, you got to try on a few things to figure out what works for you. And a lot of us do work together. So if you can name, sort of what you're cultivating, what you want, that when you are looking for support, you are the person that gets to articulate what you need. So yeah.
Thank you, Michelle.
I can go, Jemmy, if.
Yes.
Okay. Yeah, so I think something I'm just interested in now is that, and thinking about this more through this conversation, is just the notion of curiosity in a non-voyeuristic kind of way, and thinking about challenging expertise and sort of like what would it mean to kind of relax into, as advocates, to sort of relax into more of a position of not having to knowing that there are certain things we're responsible for knowing and need to know, and that we're important resources to people. But for the dynamic of just being able to listen better to people, to sort of loosen that a little bit. And I'm saying this partly because I just want to say in this forum, I heard an interview the other day with a psychologist named Christine Runyon, and she was talking about curiosity, and she said that the neurotransmitter of curiosity is dopamine. That just blew my mind. Like, dopamine's the one that makes you happy. So just thinking about the potential there to be in conversation collaboratively with survivors, and what could really come from that.
Thank you so much, Julia. Who's next? I want to hear from all of you.
Okay.
Zach. Oh, so Michelle and then Zach.
Okay, cool. Yeah, I think as like a summing up or conclusion, like I think we all agree that centering community and survivor voices is essential. And I think that we need to proactively seek to do this, like in all of our work, and whatever sector we work in. We work more on the advocacy side, but wherever you are in the community, like if you are on the council, if you're in government, if you're in the private sector, like what policies do you have? Who are you leaving out? What policies can we develop that center survivor voices more? What in all of our environments can we look at and integrate survivor voices into to create systems change? And I think just going back to the justice question, I think justice, like others have said, means that this doesn't happen in the first place. And so preventing sexual violence from happening is going to take systems level change, and integrating survivor voices into making that change and what we do to make that change.
Thank you, Michelle. Zach.
What I want to say is, going forward, us being in the Zoom call, it can feel extremely overwhelming to have to navigate through all that by yourself and to bring it to your own local community. But know that don't put all this burden and hard work on your shoulders. You now have connection with all of us. Here, we are going toward the same end goal of making sure that we are advocating, we are reaching out, and we're speaking to the marginalized communities and to the victims and survivors of domestic abuse and sexual violence. So even if you feel like, oh, you can't reach out to this person, or you have somebody within your organization who wants more resources, look at the computer screen in front of you. You have so many resources and allies who are here to guide you and walk you toward the finish line of achieving this one goal of eradicating and advocating and educating our folks to speak up against domestic abuse, sexual assault, violence towards anybody. And also to keep reaching out to those marginalized communities where they may not feel comfortable speaking out against violence and domestic abuse in their community, only because of the stigma and because of the narrative that folks create around, oh, if you speak out, you probably deserve it, or people like us of our skin color, we don't talk about these things, we just sort of have to deal with it because that's how society placed upon it. So we also have to be going out to these communities and sort of erasing that narrative and getting rid of that stigma that, just because you're from a certain economic class or because you're a certain race color and all that all these narratives and everything that are working against you are not true, and that there's help available for you and we are here for you. So definitely reaching out more to the marginalized community, the LGBTQ community, the trans community, where a lot of our brothers and sisters end up being killed because they're speaking out or because somebody finds out, because most of their work, most of their income is from sex work, and there's not a lot of laws out there that are protecting them. So they go out and, people find out, hey, you're trans, I don't like it, and I'm just, and when they speak out against it and they beat them, they end up being killed and murdered. And there's a high skyrocketing rate of murders against our trans brothers and sisters. They definitely know that sexual assault, sexual violence can happen to anybody. And to educate and learn about some of the things within other communities, such as the LGBTQ population, the BIPOC community, what is the narrative, what is the conversation going on in those communities, and how we as allies and different community organizations can help step in and continue that conversation, to continue that advocacy. We are all advocates here, and just know that you are not alone in this fight. We are all in this together.
Thank you, Zach. Monica or Jennifer, not to put you on the spot.
Yeah, I'll go. Yeah, I'm also coming back to the topic of justice and what that looks like. I think, like what others have said, that justice can often, people think of it as one way, like law enforcement going through the court system, someone going to jail potentially. But I think I would just say, just keeping in mind that on an individual level, we can always practice and deliver justice to survivors in our interactions with them. We can bear witness to what they've gone through. We can help to facilitate access to compassionate, trauma-informed care, whether that's in the medical system, sometimes it's not, whether that's in the community, connecting them to community resources. And it looks like just supporting survivors' self-determination and providing options so that they can make the best decisions for themselves that will help them in their safety and their healing journey. And just treating them as the expert, and knowing that they're the expert. And yeah, so leave it at that.
Thank you, Monica. Jennifer, any parting words that you'd like to take away with?
I definitely echo with everything everyone is saying, because that's really the core of it, which is centering survivors' voices and making sure that they are also aware that they are the expert in their lives, right? And like the way we approach our services is kind of like what Julia was also saying, which is like that curiosity of like, how can we support you in that like journey? Like if you need to, like, if you don't want to have the court involved or justice in that way, then what does it look like to you, and how we can facilitate that? And maybe that is really about even dismantling some of those services and demanding things for our clients at a larger scale. Access to healthcare, that is something that, we definitely need to have for everybody, not just maybe US citizens or, people like that, because like having healthcare at the most basic level provides that at least security to get the resources and not worry about, the bill that's going to come, right? And then also like, then you have connection to at least, a possible counseling. Maybe there's more resources into your own language. There's steps that we can really bring that in and create a better, just world. And I know Jamie said, is that like too optimistic for me? But no, I really think that we need to create that like violence-free world. I love being a mental health counselor, but I also would like violence to end, and I don't want to be a mental health counselor because violence is around. I want to be there to support clients, but I also want violence to end. Please and thank you.
Thank you, Jennifer. And now Councilmember Rosenthal, you are the last council member standing and you get the last few minutes.
Well, I'm going to take 30 seconds because I'm sure everyone else here has something more important to say. I've had to go on and off and I'm half on a hearing but this is the conversation that the next mayor has to be having when we talk about our response to sexual harassment, sexual assault. You're the ones with the, deep down in your heart knowledge of how the city should approach prevention, as you just mentioned, Jimmy. But that there has to be a full discussion of what does justice mean. I mean, for the past 3 years, I've been bashing my head against the wall trying to reform the Special Victims Division of the NYPD. Yet, when you really think about it, what percentage of cases actually, that whole thing has to be reformed, yes. But first things first, when a survivor comes forward, they need to get the help they need. Full stop. In the Victor Rivera case, the first response from the mayor's mouth should have been, we've reached out to those survivors and offered them services, right? Jean Kim has come forward this morning. My first response to that is, I hope she's getting good counseling services, because the God's work that you all do is fundamental to helping people get out of bed in the morning when something terrible has happened. So I guess thank you is all I'm saying.
Thank you, council member. And thank you to the entire Women's Caucus for hosting us this morning, this afternoon. Happy Denim Day. I know it's just one day of the year, but this work is every day of the year. We're going to continue to be doing this work, continuing to be active, to advocate, to listen to survivors, to believe survivors, to focus on healing, to focus on justice. This work is never going to end unless we make it end. So thank you all so much. Join us at our Denim Day rally with our friends at Peace Over Violence in LA at 5 p.m. It's going to be live streamed at the Peace Over Violence YouTube. We have folks from GGE, from VIP, from Steps to End Family Violence, and so many others that are going to be representing our community this evening. So thank you all so much for joining us today, and enjoy the weather. Just enjoy the weather. Bye, everyone. Thank you all so much.
Thank you. Thank you.
Thank you.
You take